Why is it important for people to get screened regularly for colorectal cancer? Colorectal cancer is one of the leading causes of cancer deaths in the United States and worldwide. On average, every year, 50 to 55,000 Americans die of colorectal cancer. Numerous more cases are diagnosed but are caught early, and people survive this disease. The goal of colorectal cancer treatment is really prevention. We as healthcare providers want to prevent patients from progressing from polyps to colorectal cancer. Polyps are a type of growth that we encounter in the colon wall, which with established science and data from studies previously tend to grow at a very slow rate. These polyps over time, on average 7 to 10 years, can then mutate and turn into colorectal cancers. Our goal is to prevent these polyps from transforming into colorectal cancer and catching the disease, if present, early to allow for treatment. Patients who catch their disease early with screening in a stage 1 colon cancer have almost a 95 to 96% chance of surviving this cancer with surgery alone. Once colorectal cancer advances from stage 1 to stage 2 and stage 3, the survivability rate goes down significantly. Hence, we want to catch this disease early. Colorectal cancer is a disease that people are oftentimes embarrassed about talking with their peers, with their family members, but it's a discussion that we need to have. And as healthcare providers at Allina, we need to have the discussion with patients to help coordinate which colorectal cancer screening modality is best for them. What role does family history play in screening routines? Talking about colorectal cancer oftentimes is not the most comfortable thing to do, especially in Minnesota with our stoic backgrounds and dealing with harsh winters. People don't like to talk about colorectal cancer around the Thanksgiving dinner table or the holiday tables, but it is discussion that needs to be had with your family members. We know as gastroenterologists that patients who have a family history of colorectal cancer or advanced polyps are at increased risk for developing colorectal cancer themselves. Obtaining a very careful and detailed family history of colorectal cancer is of the utmost importance in determining how we go about screening and at what age do we start colorectal cancer screening. What community should be on the lookout for colorectal cancer? I think in dealing with colorectal cancer, everybody needs to be worried and concerned about colorectal cancer. In looking at the different demographic breakdowns of colorectal cancer, we do know that African Americans, especially African American males, are at a dramatic increased risk for colorectal cancer. Colorectal cancer mortality in African American males is 20 to 25% higher than the Caucasian population. The United States Preventative Task Force Services have actually recommended this last October of decreasing the average age at one should start colorectal cancer screening in the African American population to age 45 from 50. Other ethnic groups which tend to have a higher risk of colon cancer mortality are our Native American populace in the United States, and they too should probably start their colorectal cancer screening earlier at age 45. Now, when we talk about earlier in regards to age, we're talking about patients that have no familial risk of colorectal cancer or have no history of any diseases such as inflammatory bowel disease, which can put them at increased risk. We're talking about average patients with no risk factors. And so when we look at average age when we start colorectal cancer, in the United States, 50 has been kind of the established norm for colorectal cancer screening. We have all been taking note in the mainstream media and you pick up the local newspaper, you'll see that younger people are becoming affected by colorectal cancer at numbers that we've never seen before. And this is pushing studies looking at to see what is going to be the optimal age to start screening, because in my opinion right now, starting colorectal cancer screening at age 50 is probably too late. We are, I think, moving now in the direction of going to 45 as kind of the start point for screening people for colorectal cancer with no other risk factors. Now, if patients do have risk factors, if they do have a first-degree relative, such as a parent or sibling with colorectal cancer, that is a different entity in itself in regards to when we start screening for colon cancer. If a patient has a first-degree relative with a colorectal cancer or advanced polyp under the age of 60, we usually recommend that patients start their colorectal cancer screening at age 40. If they have a first-degree relative, such as a parent or sibling that had colorectal cancer or an advanced polyp under the age of 50, let's say 45, we would recommend starting 10 years prior to that incident of disease. For instance, a 45-year-old brother who had colorectal cancer, we would recommend their siblings undergo colorectal cancer screening starting at age 35 and then every 5 years thereafter. What are the different types of tests that someone could use to screen for colorectal cancer? Any screening is better than no screening at all. And oftentimes patients are intimidated by the experience of colonoscopy. They've heard horror stories. You only need to watch a sitcom or a comedy routine and someone always makes comments about the unpleasant nature of colonoscopies. We've come a long way and they actually are very well tolerated by patients, but there are other ways today to screen for colorectal cancer other than colonoscopy. One of the tests is called a FIT test. And a FIT test is a test which examines for hemoglobin, which is essentially a component of blood, in a patient's stool. And it is a very easy test to undergo because you are able to do this at home in the convenience of your own home with no downtime. You submit a small stool sample and it is mailed in and it is evaluated for a breakdown in blood products such as hemoglobin. Current literature supports that if a positive FIT test is obtained, the patient should undergo a colonoscopy within 90 days of that positive test. The other test that is commonly used for colorectal cancer screening is a FIT DNA test. And this is the test that people probably have seen advertised in between sitcoms, football games. It's called Cologuard. This test, once again, has the ease and convenience of being done at home. So you avoid all the unnecessary downtime pre and post colonoscopy. The difference with this test and the FIT test is that you have to submit an entire stool sample. So the FIT test is just a very small amount of stool that you submit to the clinic or lab, whereas the Cologuard test, you need to submit an entire bowel movement to the clinic or lab. The way that this test works is it detects for hemoglobin in your stool, but more importantly, it checks for abnormal DNA, methylated DNA, which we see in colon cancers, will show up in this stool study. So once again, this test is a very good test. It has high sensitivity at picking up colon cancer, not as good at picking up large polyps, but a very good test. And once again, our goal is to get people screened. Not every screening modality fits every patient. Now, the screening interval for this test is every 3 years. Once again, as with the standard FIT test, if this test is positive, you need to undergo a colonoscopy.